first let us talk on certain issues which are very important, but not being taught previously in our education. So our decisions differ every time, and everybody should be aware about all those basic principles as far as health is concerned. The in the health or the health sector, it is totally a different sector as if we compare with other sectors. The difference is in this service area. We should go through the slides also. The health is, as we know, what is the expectation of a person from the health sector is appropriate treatment, appropriate management of his ailment, disease ailment or anything. So appropriate treatment and appropriate management, that is very important. But if you see, many times you go to the government hospital, many people will say, oh, that they are not satisfied with the service. Though the doctor as well as paramedics, everybody there, as far as disease was there, they treated it very well. So it is not only treatment and management of ailment or the disease, but it is the satisfaction of a patient as well as relatives together. That is an additional thing which is very important in the health sector, which may not be true for other sectors. So it is not only treatment of a disease, it is the satisfaction, which is very important. That's why many of us try to go to the private people also. That is one thing. Then second is, we have to keep it in mind that it is a science, that everybody will agree, but it is a science of probability. It is not that the thing is that this will, in mathematics or engineer or computer science or so many other things, you say 2 plus 2 is equal to 4 and this equations are there, and that is always like that only. But in this, that is the science of probability. It is a life science, and we should understand the difference. What I shall tell as an example, I shall like to tell that my experience also. One time, when is Vikram, he was he got admission in engineering college. So his father said, "Okay, I shall give you a motorbike," and he purchased a motorbike. But he used to drive very fast. He used to drive very fast. So I told him that you should drive not at very fast, but general speed or whatever slow speed you should go. He said 2-3 times he listened to me. Afterwards he said, "Mama, you tell me every time that okay, you should drive slowly. But you know, since last 2 years, I am driving at a speed of nearly 70 kilometers to 80 kilometers in city. But I have never met with an accident. But do you know Agashi, Mr. Agashi?" I said, "Yes, I know him. But he drives very slowly. His speed must be more, not less, it is always less than 40. He said, "But do you know that he recently met with an accident and he is no more now?" So, what you will tell to this person now, young chap, Vikram, that you should drive fast, you should drive slowly, or what you will advise him? Because he is a science student. He wants explanation for everything. He wants a reason. Last 2 years, he never met with an accident. This is the probability. That suppose I'm in Nagpur and you people mostly are in Mumbai, or Prashant Kokne, Dr. Praveen Kokne is in Mumbai. So if I travel from Nagpur to Mumbai on highway, 100 people are traveling on two-wheeler with a speed of average 110, then say 9 accidents occur. But If you travel with a speed of average 70, 100 people with the same speed, with the 70 speed and everything remaining same, then probability is that they may met with an accident of two persons only. So what is the thing? That the speed reduces the probability of the accident, but it doesn't give you guarantee. That is what is very essential to understand in health. Whatever we do doesn't provide that you will not get the corona, but we reduce the probability. Otherwise, what happens? Doctor, you said this, I have done, but still I got the cornea. What was the use? कुछ नहीं होता, जो भी करना है वो करो, जो लगता है वो करो. People say, Dr. Mahatme, I said once that I am getting pain in my stomach. I had some disturbance, bowel disturbance. They said, but you take always the filtered water. Why you should have this problem? If you take filtered water, probability of diseases, waterborne diseases becomes very less. But it doesn't mean that it will exclude you from all those diseases. The probability is there. Once we understand this, then it becomes easy to understand every other thing in health. What is the definition of health? That is also important. The health is not merely an absence of disease, but a sense of well-being as far as physical, mental, and social well-being is there. So it's not physical only. It is mental and social also. We shouldn't forget this. This is WHO definition. This is very important to understand because we forget mental health, we forget the social health. And I shall come to this afterwards. As far as corona is concerned, what are the perspectives with which we look at the corona? There are different perspectives. I feel perspectives are very, very important. Once we understand the perspectives, then you will always respect others' perspectives, others' thoughts also. You may not agree with them, but you will respect them. So, what are the different perspectives? There is nothing like corona, somebody will say. There is nothing like corona. ये तो doctors लोगों ने बढ़ाया हुआ है and कुछ नहीं होता. And it doesn't exist at all. Somebody will say, corona is dangerous. Probably that will happen to me and my family members. And I know a few, they are expired. So I think I shall also not be able to live. आज ही मैं सुसाइड कमिट करना चाहिए. क्या है जिंदगी में, कुछ नहीं बचा. अभी कोरोना होने ही वाला है तो कितनी तकलीफ होती है हॉस्पिटल में जाने के बाद. If you have so many problems when you go into the hospital, let me jump from 12th floor. So that is also one perspective. Another perspective can be, corona is a great challenge. And I think I should think over what can be done. What should I do so that I do not get, I reduce the probability of getting corona and I reduce the probability of getting corona to my family members. What are the factors within my control? So this can be also one perspective, and there can be a number of perspectives. And this perspective decides what things you will pick up. And that is very important. And that is all about mental health. So I shall come to that again. As a whole, if we see, I think corona was a great teacher also. I feel, but for that, we have to accept the perspective that, okay, I have to learn from it. And what were the teaching lessons by the corona? A great teacher. One thing is very important, that cleanliness is very important. Hand washing, hygiene. Every time you wash your hands. I think if we adopt it as a routine, that will be always better. And we should not forget those lessons which the corona has taught us. Together, not only me and you, but to the community. Washing of the hands, cleanliness, I have told you. Then everybody became aware that public health is very important. Means I shall be healthy only if my family members are healthy, only if in community there is no corona, only if in the state there is no corona, only if in the country there is no corona, only if there is no corona in the universe of the earth globe. So we understood that public health is very important. We understood that it is not the doctors only, paramedics, even the other engineers also. They also contributed. I seen that, okay, from sewage line, you can detect that this colony is affected by corona because the samples collected showed more number of, whatever the excreta shows, more number of corona replicants. So that engineer could tell. Then analytics showed where it will happen, more cases will be happening, more number of cases will be there in which area after a few days. That was all analytics. That was done on computers, sitting in one room and background. So everybody tried to contribute, and everybody's contribution is useful. Even you can say that food, common people also, I should come to that also. Then this was about public health. Not only we need safe water, the cleanliness and everything, that is all public health. Vaccination, that is public health. So all this, and people also contributed in this. I shall come to that again because it's a big topic. Then what was important is the One Health. I'm very proud in that, saying that in Nagpur I could bring One Health institution. What is One Health? That was prior to Corona, 3 years, 1 year back, prior to Corona. I tried to have One Health, and I tried to convince that many diseases from the animals, zoonotic diseases, what we call it, are there which are life-threatening for the human beings. We know the rabid dog which bites, and then we get this disease, hydrophobia, and ultimate death. But there are multiple, chikungunya, then malaria, all these are the zoonotic diseases. If the animals do not suffer from these diseases, we will also not suffer. If you remember, the corona was caused by one of the Pangolia, that is what we Khawlia Manjar, what we call it, Khawlia Billi, what we call it in Hindi or Marathi, Khawlia Manjar. From that, armadillo, from that it got transferred to human beings. In China, in Wuhan city, that is a market where they sell these animals, and then they cut and they eat, and then, but the diseases spread from that area. So if we want to be safe, we have to consider zoonotic diseases also, and that is called environment also. Very important. If you know, we always say, अभी जो वेदर है ना, वो सर्दी जुकाम के लिए बहुत ज्यादा होता है इस वेदर में. What is that? So climate, zoonotic diseases, and the human being together is called as One Health. And I was following it up. So every time they used to say why we want One Health. WHO also wanted to have this, but somehow I was successful in convincing the Secretary and Health Minister, Honorable Health Minister that time, also agreed, and he first One Health Center at Nagpur in India. So that is very important, because we want everybody to be healthy, then only we will be healthy. So One Health is important. Then we have, what the corona has taught is One Health is important. What the corona as a teacher taught us is that we need to have, like, We say, we every day we say that army should be prepared and army is ready, always ready to fight if somebody encroaches or somebody decides to encroach our border. They are ready to fight. They don't say that, okay, we will have a meeting and something like that. So similarly, we should have army of doctors, paramedics, engineers and staff, seaport, airport, staff people who together will be able to fight against all these epidemics. Suppose there is one disease which is spread in one area. The army of people of this health sector, they will